This is Gwyneth Hines from BRCA Positive talking about prostate cancer in light of the study today. For the first time, the number of men dying of prostate cancer has overtaken the number of women dying from breast cancer in the UK. This is mainly due to the fact that there have been improvements in both the treatment and early detection of breast cancer, and more research and work is needed to get the same benefits for men with prostate cancer. In many ways, prostate cancer is the breast cancer of men. There are many similarities, and the lifetime risk for both diseases is about 1 in 8. And the overall death rates, looking back, have roughly been about the same, with one in about 38, 39 men and women dying as a result of breast and prostate cancer. The average age of both prostate and breast cancer is in mid-60s, and the diseases are much more common as we get older. Both breast and prostate cancer are uncommon under the age of 40. We also know that prostate cancer is more common in some families, and in 5 to 15% of cases, we know that it is related to the inheritance of faulty genes such as BRCA1 and BRCA2. There's also a link with the gene mutations associated with Lynch syndrome. Lynch syndrome puts people at increased risk mainly of bowel cancer, but also of increased risk of breast and endometrial cancers. For the men who have got BRCA1 and BRCA2 mutations, they are more likely to be diagnosed with prostate cancer at an earlier age, from the age of 45 onwards, and are more likely to get tumours that will be more aggressive and more likely to spread outside the prostate gland. When we look at all the men with prostate cancer, only about 0.5% will be shown to have BRCA1 mutations and just over 1% BRCA2 mutations. If we look at that the other way around, men with BRCA1 mutations are 3 or 4 times more likely to develop prostate cancer by the age of 65 compared to the general population. But the risk for men with BRCA2 mutations is higher, with an 8 times risk. So as I said at the beginning, we think that the main reasons for the improvement in breast cancer survival are down to 2 reasons. Improved treatment. And this probably includes more targeted treatment. For example, the use of Herceptin to treat HER2 positive breast cancers. And these were often very aggressive tumours that didn't normally respond to the chemotherapy we previously had. And Herceptin has made a big difference to the survival, especially of these aggressive tumours. But as well as that, we do think that the survival rate has improved for breast cancer because of early diagnosis with mammography. Now, it's important with any screening test that we're finding the tumours that are the ones that are more aggressive. There's no point in just finding wee piddly tumours that weren't going to grow and cause any problems in the first place. So this is the challenge that there is for research looking at ways of improving the survival rates for men with prostate cancer. There is a study ongoing at the moment, which is an international study, and it's looking at prostate screening for men who are deemed to be at increased risk because they carry the BRCA1, BRCA2 gene mutations and also the Lynch syndrome mutations. This study has already recruited over 3,000 men throughout the world in various centres, and the men are aged between 40 and 69. The PSA blood test has been recognised for many years as a way of picking up prostate cancer, but it has been looked at in a slightly different way for these men. They have blood tests taken every year, and then if the test is deemed to be outside the normal limits, they are referred to hospital for a prostate biopsy. Because the men with BRCA1 and BRCA2 mutations are more likely to have aggressive forms of prostate cancer, early detection is more important. So this study is ongoing, and we will not have the full results for several years yet, but initial reports have been encouraging, and it has shown that this targeted screening is successful at picking up these more aggressive tumours. We will have to wait for further follow-up to see whether or not this then leads on to an improved survival. But certainly it may well be a way forward for men, especially if they carry the BRCA2 mutation. There is more information at the BRCA Positive website. And if you have any questions regarding this study or about prostate cancer in men in BRCA families, please visit the Facebook page and leave any questions that you might have there. Thank you.